Ever look in the mirror and notice your skin is drier, your face puffier, or something just feels off? Today we're breaking down 10 ways your face can reveal clues about your thyroid health, so you know when it's time to talk to your doctor. Let's start with a puffy face. It's a common concern, and while occasional puffiness can be attributed to various lifestyle factors, persistent facial swelling warrants a closer look. We're going to delve into a specific type of puffiness that might signal an underlying health condition. We're talking especially about swelling around your eyes. This area is particularly susceptible to fluid retention, and noticeable puffiness here can be quite telling. And cheeks. The fullness in your cheeks can contribute to an overall rounded or swollen appearance of the face. Now this isn't just your run-of-the-mill morning puffiness that usually subsides within an hour or two. We're talking about something more persistent. It's a persistent, doughy swelling called myxedema. This type of swelling has a unique characteristic that sets it apart from other causes of facial puffiness. Myxedema is often linked to hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormone. When your thyroid is underactive, your metabolism slows down significantly. This slowdown has a cascade of effects on various bodily functions. As a result, certain compounds, specifically glycosaminoglycans, build up under your skin. These compounds attract and hold water. This buildup pulls in water and causing that characteristic puffiness associated with myxedema. It's like a sponge retaining excess moisture. Unlike typical swelling caused by fluid retention or inflammation, this type of swelling doesn't leave an indent when pressed. This is known as non-pitting edema. It's most obvious around the eyes, often presenting as periorbital edema. This is because the skin around the eyes is particularly thin and delicate, making it more susceptible to showing signs of fluid accumulation. You might wake up looking fuller in the face than usual, noticing a subtle but distinct change in your appearance. This can manifest as less defined facial features and smaller-looking eyes due to the swelling of the surrounding tissues. It's important to differentiate this from swelling caused by allergies, which usually presents with other symptoms like itching and hives, or sinus issues, which often involve localized pain and pressure in the sinus areas, or kidney problems, where swelling is often accompanied by other signs of kidney dysfunction. Hypothyroid puffiness is more generalized, affecting the entire face, and usually comes with other symptoms like fatigue, weight gain, and dry skin. So if you notice unexplained ongoing facial swelling that doesn't seem to be related to allergies or other common causes, it's a good reason to get your thyroid checked with a simple blood test to assess your thyroid hormone levels. Your face could be showing you the first sign of a deeper issue, acting as an early warning system for your overall health. Don't ignore it. Talk to a healthcare professional to explore the potential causes and receive appropriate guidance. Early detection and management of hypothyroidism can make a big difference in alleviating symptoms and improving your quality of life. Dry, rough, or pale skin. Your thyroid might be to blame. Low thyroid hormones slow skin cell turnover, leaving dead cells on the surface and making skin feel scaly. Less oil and sweat production means your skin can't stay hydrated. Pale skin can signal anemia from low thyroid hormone, while a yellowish tint may mean your body isn't converting beta-carotene properly. These changes are classic for hypothyroidism. Hyperthyroidism, on the other hand, can make skin warm and moist. If your skin is always dry and pale and moisturizer isn't helping, it's time to consider your thyroid. Your skin is a window to your internal health. Don't ignore what it's telling you. Take a close look. Really observe your eyebrows in the mirror. What do you see? Notice the outer third of your eyebrows. This area, furthest from your nose, can sometimes tell a story about your health. Are they thinning, or perhaps even disappearing altogether? Compare how they look now to older photos if you have them. Is there a noticeable difference in density, specifically in that outer portion? Thinning or disappearing? That's a classic sign of hypothyroidism, also known as an underactive thyroid. It's a condition where your thyroid gland isn't producing enough thyroid hormones. Thyroid hormones play a vital role in many bodily functions, including hair growth. They keep hair follicles growing, ensuring a healthy cycle of hair production. Think of them as the fertilizer for your hair, but without them, eyebrow hairs enter a resting phase prematurely. This resting phase is when hair growth stops, and eventually the hair falls out. Without them, eyebrow hairs enter a resting phase and fall out. The outer third is especially sensitive to hormone changes, making it a prime indicator of thyroid issues. It's often the first place where hair loss becomes noticeable when thyroid hormone levels are off, making this a specific clue. This isn't the same as age-related thinning, which typically affects the entire eyebrow gradually. It's also different from hair loss caused by overplucking. Repeatedly plucking hairs can damage the follicles, preventing regrowth, or overplucking. If you're using less eyebrow pencil on the ends, because there's simply less hair to fill in, your body might be sending you a message, a subtle signal that something's not quite right. Severe hyperthyroidism, an overactive thyroid, can also cause diffuse hair thinning, affecting the entire scalp. But the loss of the outer third of the eyebrows specifically is a hallmark of an underactive thyroid, a key indicator that warrants further investigation. So check your brows. They could be your early warning system, providing valuable clues about your thyroid health. Don't brush it off as just a beauty issue or a cosmetic concern. It could be a sign of something more significant happening within your body. Don't brush it off as just a beauty issue. It's worth a conversation with your doctor to discuss your concerns and explore potential underlying causes. Hair loss can be a distressing experience, and it can manifest in various ways. One of the most noticeable areas where hair loss occurs is, of course, on your scalp. It's often the first place people check when they suspect something is amiss with their hair. But hair loss isn't limited to just the scalp. It can also affect your face. Thinning eyebrows or a receding hairline can significantly alter your appearance and be a sign of an underlying issue. Or could it be body hair? Sometimes hair loss isn't isolated to the head or face. It can occur all over the body, leading to a decrease in hair on your arms, legs, and other areas where hair is typically present. So, what could be causing this widespread hair loss? Well, both underactive and overactive thyroids, conditions known as hypothyroidism and hyperthyroidism respectively, can cause it. Thyroid imbalances can disrupt the normal hair growth cycle, leading to increased shedding and overall hair thinning. Hypothyroidism in particular pushes hair follicles into a resting phase, also known as the telogen phase. This prolonged resting phase leads to diffuse shedding, where hair falls out evenly across the scalp rather than in specific patches. You might notice more hair in your brush after styling, or find an increased amount of hair strands on your pillow when you wake up in the morning. Another common sign is excessive hair falling out in the shower while you're shampooing and conditioning. Beyond just shedding, hair affected by hypothyroidism often becomes dry, brittle, and dull, losing its natural shine and elasticity. On the other hand, hyperthyroidism shortens the hair growth cycle, causing hair to grow faster but also become weaker. This results in hair that is fine, soft, and unfortunately more prone to falling out due to its weakened state. So, what's the difference in texture between hair affected by these two opposing thyroid conditions? Hypothyroidism tends to make hair coarse, rough, and difficult to manage. Conversely, hyperthyroidism often makes it silky and soft to the touch, but also weak and fragile. Now for the good news, thyroid-related hair loss is usually reversible with treatment. Once your thyroid levels are brought back into balance, your hair follicles can recover and resume normal growth. Of course, many things can cause hair loss, from genetics to stress, but if you're experiencing other symptoms commonly associated with thyroid disorders, it's essential to get checked by a healthcare professional. Don't wait for the hair loss or other symptoms to get worse before seeking medical advice. With proper treatment and management of your thyroid condition, your hair can grow back, restoring its health and vitality once your thyroid is balanced. It's crucial to see a doctor for proper testing to determine if a thyroid issue is indeed the root cause of your hair loss. Don't self-diagnose based on information you find online. Instead, get answers from a qualified medical professional who can accurately assess your condition. Remember, your hair's health can often be a reflection of your thyroid's health, so taking care of your thyroid is essential for maintaining healthy, vibrant hair. A visible lump or swelling at the base of your neck? That's called a goiter, an enlarged thyroid gland. Goiters can happen with both underactive and overactive thyroids. Causes include iodine deficiency, Hashimoto's thyroiditis, and Graves' disease. Sometimes, a goiter is small and only found by a doctor. Other times, it's obvious and can cause tightness, trouble swallowing, or a hoarse voice. Any neck swelling deserves medical attention. Your doctor will check your thyroid with blood tests and an ultrasound. Don't ignore a lump. Early evaluation is key. A goiter is your body's way of saying something's up with your thyroid. Get it checked out. Drooping or retracted eyelids. This could be thyroid eye disease, most often linked to Graves' disease and hyperthyroidism. The immune system attacks tissues around the eyes, causing swelling and inflammation. This can push the eyes forward, bulging, or make eyelids droop or retract, creating a wide-eyed or sleepy look. These changes can affect vision and often happen gradually. If your eyes look different or people comment you look surprised or tired, don't ignore it. Thyroid eye disease needs care from both an endocrinologist and an eye doctor. Eye changes are a serious sign. Get checked. Early treatment can prevent complications. Your eyes are telling you something important. Red, gritty, or watery eyes. These are common in thyroid eye disease. Eyelid changes expose more of the eye, leading to dryness and irritation. Dryness triggers inflammation, redness, and sometimes excessive tearing. Light sensitivity is also common. If eye drops aren't helping and you have other thyroid symptoms, it's time for a thyroid check. Don't dismiss persistent eye discomfort. The combination of eye irritation and eyelid changes is a strong thyroid clue. See a doctor for answers. Constant facial redness or flushing even when you're not hot or embarrassed. This can signal hyperthyroidism. Too much thyroid hormone revs up your metabolism, increasing blood flow to your skin. You might feel hot, sweat more, and have a rapid pulse. This flush is different from rosacea or hot flashes. It's persistent and comes with other sped-up symptoms. If you look like you have a mild sunburn all the time, don't ignore it. Flushing can have many causes, but with other symptoms, think thyroid. Your body's cooling system is in overdrive. Get checked if you notice unexplained, ongoing redness. Fine lines and wrinkles aren't just from aging or sun. Thyroid imbalances can speed them up. Hypothyroidism dries out your skin, making lines more visible. Both hypo and hyperthyroidism can reduce collagen and elasticity, leading to sagging and wrinkles. Hyperthyroidism can also break down skin proteins faster. If you're young and notice rapid skin aging, especially with other symptoms, consider your thyroid. Not every wrinkle is a thyroid problem, but sudden changes are worth investigating. Your skin's structure depends on healthy hormones. Don't ignore premature aging. Get checked. Persistent stubborn acne, especially along the jawline and neck, can be a sign of thyroid trouble. Thyroid hormones regulate other hormones, including those that affect oil production and skin cell turnover. Hypothyroidism can slow hormone clearance and is linked to conditions like PCOS, which causes acne. Dry, flaky skin can clog pores, while hyperthyroidism can increase sweat and oil, also leading to breakouts. If adult acne isn't responding to treatment and you have other symptoms, ask your doctor about your thyroid. Hormonal imbalances often show up on your skin. Don't just treat the surface, look for the root cause. Your skin could be asking for a thyroid check. Your face and neck can reveal early signs of thyroid issues: puffiness, skin changes, eyebrow thinning, eye symptoms, and more. These clues aren't diagnoses, but they're worth paying attention to. If you notice several of these signs, talk to your doctor and get your thyroid checked. Early detection leads to better outcomes. Thanks for watching. Subscribe for more health tips, and remember, your body is always talking. Listen closely, stay healthy, and see you next time.